Hello, viewers. Today, on the eve of World Health Day, let's begin with the prayer Sarve Bhavantu Sukhina, Sarve Santu Niramaya, true wealth of holistic health and happiness for all. Truwellth Integrative Health Centers were established with the mission to reverse, control, and prevent diseases and augment health by integrating all appropriate scientific evidence based personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic wellness approach. This also coincides with our Prime Minister's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Aligned with this year's World Health Day theme, Together for Health, Stand with Science. Truwellth brings together a distinguished panel of leading experts across specialties to move beyond fragmented care and discuss what is driving the rising burden of modern diseases today, and are we really treating symptoms or addressing the root causes? And most importantly, how can we integrate science of nutrition and lifestyle management with medicine, advanced surgeries, and more to create sustainable long term health outcomes? Because the real question is not just how to treat a disease, but how to build sustainable lifelong wellness. And with that, let us begin with this important session by introducing the esteemed panelists here today on the eve of World Health Day. We have Shilpa Joshi here. She's MSc RD and renowned clinical nutritionist and diabetes educator with over 2 decades of clinical mastery. Dr. Shilpa is a trailblazer in MNT, which is the Medical Nutrition Therapy. As director of Mumbai Diet and Health Center, she specializes in metabolic reprogramming and diabetes management, combining rigorous scientific research with personalized patient care. Then we have Neeti Desai here. She's consultant clinical dietitian and personalized lifestyle nutritionist. Neeti Desai is a leading voice in lifestyle integrated nutrition, and she's celebrated for her ability to translate complex clinical data into practical personalized diet strategies that fit the modern individual's life, focusing on long term wellness over short term trends. And finally, we have Dr. Bijal Ladak. She's assistant professor, SNDT Women's University, and food product development specialist, an expert academician at SNDT's Department of Food Science and Nutrition. Dr. Lalan specializes in the synergy between nutrition counseling and innovative food science. Her work in food product development ensures that nutritional science is translated into practical, healthy consumer solutions. And lastly, a little about me. I'm a celebrity nutritionist and founder of Truwellth Integrative Health Centers and RSG Energy and Nutrition. With over 2 decades of global experience across healthcare, nutrition, and nutraceuticals, I firmly believe that nutrition can be modern day's most effective and safe therapy in various lifestyle, autoimmune, as well as infectious diseases. Through Truwellth Health TV, we have reached more than 2 million viewers by anchoring 400 plus patient education programs and initiatives with 1,000 plus global healthcare and nutrition experts to spread authentic disease and integrative treatment information. With that, I really extend my warm welcome to the distinguished experts who are here on the panel today. And welcome, Shilpa, welcome, Neeti, uh, welcome, Bijal. I am actually going to straight away jump into a lot of these questions, which of course, patients or healthy individuals have in their minds, but also something which we keep discussing and really want to share those with the general population, so that a lot of myths are out of the door, and we are able to put forth real science in front of them. So my first question really goes to Shilpa. And Shilpa, with rising burden of diabetes, obesity, metabolic disorders, despite the fact that we have so many drugs and nutraceuticals happening. There are two parallel trends today that we see. On one side, there is advanced pharmacotherapy like weight loss drugs, and on the other hand, we have lifestyle and nutrition interventions. So all of this is going on. But from your extensive clinical experience, how do you see the role of medical nutrition therapy in comparison and in integration with these newer therapies that are coming up?
So,
And then, do you think really that a structured approach in nutrition can really drive the outcomes?
so at the outset, thank you so much for having me here. Great being here. Now, you have to understand that the weight loss drugs, which are creating so much noise today in the market, actually, if you look at them, they are support to lifestyle rather than they're having support of lifestyle. So it's very important for one to understand that lifestyle is always the base of pyramid, and lifestyle, which includes nutrition, which includes exercise, which they are going nowhere. So whichever drugs come and go, if your lifestyle is not set right, if your nutrition is not set right, then this is not going to work. And with these drugs, what we are seeing is there are such a plethora of side effects which are there, that rather than it leading just to weight loss, which we want it to lead to, there is a lot of malnutrition which is running parallel to it, right? And that, to prevent that, it is very important that there is good nutritional support in terms of choosing right foods, in terms of nutraceuticals, whatever it may come to. But nutritional support is very, very important to minimize the impact, minimize the ill effects, whatever little are these of those drugs. So, medical nutrition therapy is the cornerstone, is what I'm trying to say.
Yes, and that's what we wanted to hear from, especially from you. So, that's heard loud and clear. But, again, on the other hand, with so many processed foods, so much of noise, even in the supplements that we're seeing, uh, and I feel and I hear also that there is growing consumer confusion. So how do we ensure that the nutrition science actually translates into safe, effective, real world solutions?
I
What
think
are your best suggestions?
the problem is there is just too much noise, and most of the noise comes from influencers rather than people who actually look at people who have these problems. So, typically when people speak about malnutrition, the picture in head is somebody who is emaciated, who has thin hands and legs, and so on. So that's not true. Obesity is malnutrition by itself, and the way to solve it is to understand, a way to combat malnutrition is to understand what good nutrition entitles. And I think that is where one needs to go to a clinical dietitian for help, yeah, rather than relying on the most famous WhatsApp university. There is one good morning every morning. With that, there is one big written matter which is sent, half of which has no meaning, right? More than 80% of it has no meaning. So I think it is very important that we understand nutrition, because processed food again is a huge plethora. There are minimally processed, and then there are extremely processed foods. And with the kind of lives that we are leading, all of us are busy. Lot of us really do not have time to cook from scratch like our mothers did, however much we would want to. So it is not that people don't want to, but it's really difficult in the life that we are leading. So therefore, put not eating anything out of packet is a dream which very few people can afford to lead. So somewhere we are going to eat out of a packet, but let that packet not be full of things which are not wanted. So therefore, understanding processed food as a concept, because processing is important, and if you need some shelf life, some amount of processing will be there. But I think understanding it as a concept talking about minimally processed food, teaching people to read labels and to read the ingredient list, I think both are very important. People are busy looking only at fat in the ingredient list. They are not looking at other things because 20 years back, fat was a bad word. Today, carbohydrate is a bad word. So after 20 years, maybe people are only going to read sugars. So that's not how a nutritional label, it has to be read in totality. The ingredient list has to be understood in totality. And if we are able to teach our common consumer these things, then I think selection of food, this whole noise about processed foods being bad, is like, it's a very overarching statement to make. Not everything is bad, so we need to understand it better as a concept.
Well, I think if I get the chance, I can sit here all day. And if I have to talk about labels on nutraceutical products, or nutrition supplements, I can go on and on. And, there is just so much to be understood. It isn't as complicated if it's simplified. And, which is why I really want to go with my next questions to Neeti, because, she sort of translates complicated stuff to make it more easy. But yet, today we see people are exposed to so much of information. Still, execution is such a big concern. I think especially the Gen Z, you will see that they know so much, but also Gen Y and Gen X are know so many things. And despite being a personalized nutrition expert, what is that real struggle? Why do people, after advice, after understanding, also they are not able to follow the diets? And why are the sustainable health outcomes is still a question mark? So in your experience, what do you really think is the biggest gap? Is it knowledge? Is it personalization? Or is it the lack of integration into real life, or lack of integration into the medical system? What is it that what's going on out here? You can explain that to us.
Right. On the outset, thank you, Rajashree. It's always a pleasure being on the
Yes.
platform. I think it is a little bit of everything. Basically, when it comes to nutrition, there is more of misinformation than information. I think that has been our one of the biggest banes. Half of the consultation time goes in correcting or unlearning what the patients have come with. Oh, I read on Insta this. Oh, somebody told me this. So there is just lot of misinformation, as Shilpa said. It's just all over the place. Maybe these many of these social platforms, for example Instagram, may be very good for say recipes and for how to see how to drape a sari, but when it comes to science of nutrition, I think we need to go back to some more credible sources. I think that is where we can start. Everybody needs to understand that nutrition is a science. It is not somebody's opinion. It is not somebody who has lost 5 kilos cannot be uh, throwing light on the entire science of nutrition. So I think the credibility is extremely important. Also, integrating it into daily lifestyle. uh, People want quick results, so that is again, this is about lifestyle change. It's not like you're on a diet and then you're off a diet. That mentality has to go. These are long term sustainable changes that we need to make, which we can carry through our lifestyle. Slow, so that is important. And I think when it comes to integration into medical science, I think we have been we're getting there. There is, as you mentioned earlier, there is a lot of acceptance. I think nutrition has found a place in whole therapy, holistic therapy
Yes.
for patients. So I think we are in that sense, we are in a sweet spot now. But yes, a lot of
Yes.
work needs to be done.
Yes. But I'm glad you highlighted nutrition science, and despite there being so much of noise and so much going around, nutrition science should be at the core. And but sometimes, as experts, do should we feel apprehensive? Or what is that we should sort of think? Because all these days we were trying and working hard towards sort of trying to tell people how nutrition is important, trying to tell healthcare experts how important nutrition is to be integrated. And now when it started getting integrated, we are obviously getting invaded with so much of misinformation, or rather people trying to follow so many things. So it's though it looks like a sweet spot, I think more noise and more awareness from us is probably needed, so that we are able to retain the sweet spot finally to ourselves, and sort of give the right advice. Correct me if I'm wrong, but this is why I'm going to this year very actively do more of these sessions, so that we get more expert advice coming from all of you.
No, you are absolutely right. Right, the awareness has to go up, and as I said, the awareness from the credible sources. So, in
Yes.
that sense, maybe as a fraternity, we as a fraternity, the credible fraternity, maybe we need to make, as you said, some more noise. And what you are suggesting is, I think, a step in the right direction.
Yes, absolutely. Yeah, and I will come back with those pointers maybe a little towards the end. But also, I wanted to have ask a couple of more questions with you. One was, of course, these days people want to, as you rightly said, everyone wants quick results. So, weight loss, detox, all these different shortcuts that are there. How do we get people to sort of get away from that, and work towards more sustainable wellness, and to understand that these are long-term therapies, or rather, start early, etc. So what are your more deeper views, or maybe if you could share some methods that we could follow in doing this?
So I think again here I am over the years I'm seeing a little shift. Earlier there was this huge demand for these shortcuts. Lot more people are realizing that these are shortcuts and these are efforts which are bound to fail. So I do get much lesser kind of demand for this. I want to lose 10 kilos because I have a wedding next week, kind of a thing. Or I had a very bad December, and therefore I want to go on a detox diet, kind of. So, these, I mean, there have always been these patients or clients. But I think people are realizing that it is a lifestyle change, and very often we don't need to even convince them, because a lot of them have even tried it in the past and they've realized it's not happened, or it's all come back. They have stories from their neighbors, friends also. But from our side, I think again it's about the credibility. It is getting the trust of our patients or clients, speaking with evidence. It's like it's more evidence based science. It's not like because I tell you to do so, or because I think so. So it has to come with lot of knowledge and respect. Then the patients are convinced and they are ready to follow what you ask them to do.
Again, one more very effective word which you used was respect. And we definitely see that rising. Respect not only for the expert, but respect for the therapy. And I think that's really bingo from your end. And that's one takeaway I am going to keep registered in my mind after hearing from you. With that, I think I will go over to Dr. Bijal with few insight questions. And today we see a surge in health foods. Foods is something, and food products is something I know, Dr. Bijal, you're very passionate about. So when it comes to fortified foods and functional nutrition, from a food science and product development perspective, how do we differentiate between science-based innovation versus these market-driven products that we see today in the market?
Quickly, thank you. at the outset for inviting me to speak to you. So, yes, there is a surge, as you mentioned correctly, in the health foods, fortified foods, functional foods, and that is driven by consumer demand. So, at our university or at our department, what we do is, and all these are for preventive health. So, what we do is we utilize the food science knowledge and we add bioactive components or compounds which improve health. I'll give you some of the examples that we have done in the current days and it has already entered the market. So we have developed fortified foods like dairy products which are fortified with prebiotics and probiotics. You see enriched foods like bakery products as well as some grains and cereal products which have high fiber and they have functional cereal grains which are added to improve the fiber, the vitamin content. We see a lot of incorporation of functional teas that are in the market after COVID. And we see a lot of functional water or energy drinks with low calorie that has come in the market, some of which have been developed at the department. So, yes, but all these foods are not market driven. The market driven foods, as you said, will have tags like no added sugar or rich in proteins. But many a times we observe that it will not have added sugar coming from sucrose, but it will come from maltodextrin. That is one of the hidden sugars that you observe in a lot of preserved, convenient foods. So I think that is what you were looking for.
Yes,
Another
absolutely.
thing
Yes.
Yes. Another thing that I would like to add is today people are talking about use of, cold pressed oils over filtered and refined oils. But there's no information available about when to use, how to use, because these cold pressed oils are pure. So their smoke points are low. They should be used at low temperatures. You cannot use them in deep fat frying because they degrade very fast and that can have an injurious effect. So yes, these things should be added to the label to make it simple for the consumers when they're using it.
Yeah, I mean, I
Yeah.
think regulators and hopefully even the authorities are listening to this kind of inputs because so much needed to be, sort of made mandatory to be included, especially in food items. There are more stringent guidelines on supplements, but on food items, these
Yeah,
guidelines
they
get to
are
be.
more generic guidelines, than it being more specific.
Yes.
So
So also, when we're talking about misinformation, and Shilpa already spoke about how important food labels are, and understanding the ingredients and what is the nutritional balance and information. Are there would there be more that you could highlight when it comes to these labels, and what are the things people should really look for? Like Shilpa said earlier, it was fat, now it's carbs, tomorrow it's just going to be sugar. So, primarily, what are the things you think the consumer should look at?
So there are a few things that I would like to highlight. Like Shilpa already said, that first and foremost, you read the label well. You read the front of the label and then you turn back and you read the back of the label. There are two things that a consumer should read very carefully. The first one is the ingredient list, where in many cases the consumers are unable to understand what is the meaning of INS. So it is an preservative that is added. So if you are unable to identify, you can always use, there are apps available. So people say AI is bad. I say it can be your assistant. So you can use an AI technology to understand or to read the ingredient list present on the food label very easily with all the details that are available. So people say low sodium food, but it will have a preservative which will have some amount of sodium, making it high in sodium. So you must read the label well. You must analyze it well before consuming it. The second, similarly, I would also like them to see that you have to read the nutritional facts very carefully. Most of the labels today give per serving. They do not give per biscuit. Like, I'll give you an example. There are few companies who say that two biscuits, when you consume, you get XYZ calories, XYZ protein, XYZ fat. But if I'm consuming four, and consumers feel that no, they have had in limitation and it is not going to hamper their weight. So it has to be made very clear to the consumer it is on serving size or per piece and not on how much they are eating. Because again, that is misinterpretation of the information given by the manufacturer. So I think some of these points should be made very, very conveniently. It has to pass on to the common man today because they are the consumers. They read the label, but these are minor things that they don't understand many a times. So I think it would make it more efficient and the objective of the government will then be fulfilled of the healthy nation.
Well, I think this really brings us to a point that we probably should do a single session on how to read labels with separate examples, because I see so many of these on on e-commerce and quick commerce these days, and they you rightly pointed out that they talk about serving size, and hiddenly in the serving size they'll write that you're supposed to consume two capsules when they are trying to project that the product has that high concentration, because it's again marketing and selling, and so they want to stand
The
in the
marketing
comparison.
strategy.
Yeah, so all these kind of smart labeling techniques and actually can fool the consumer. So a very vital topic that we will definitely go into depth one more time soon. And I think with that, one more question, because being an academician, what do you think from your experience from all these years in education training and guiding your students? How do you see the next generation of nutritional professionals shaping the future of healthcare? Neeti spoke a lot about it, but how do you see the budding ones that are coming up, and how are they sort of? Do you see that they have that much of momentum and that much of how are you training them? Has the curriculum advanced? How are things at that end?
Yeah. So a very interesting question. I think being an academician, I would love to speak on this. So today when I look at the current generation, I see a lot of them now not wanting to go and treat patient as a reactive treatment. Rather, they are looking forward to a more proactive, preventive, personalized care of an individual, where they want to include information that they have gained through curriculum about how is the genetic makeup of that person, how is the microbiome health, not just in the gut, but also on the body, in the intestine, is the permeability efficiently protecting them? If not, how can you correct it with prebiotic? How can you add more fiber and improve the gut health? How can all this together help in preventing weight gain? How can it help in preventing cancers of, say, colon, etc.? So, yes, I see a lot of curriculum change with NEP that we are able to, now create more personalized diets. That is the demand of today's hour, than just relying on the generic dietary guidelines that are available.
Shilpa, would you also like to add or throw light on this, given the fact that, being registered dietitians, and being intense about academics has been something which you have been a strong promoter of. And so do you see the newer generation and the newer curriculums being more promising?
So I personally think, see, like Neeti rightly said, the way nutrition science and nutritionist was seen 20 years back when we started practice versus what they are seen today. the light in which they are seen, the kind of work that they get to do is completely different. I think curriculums are good. I mean, I am not an academician, so I do not have sort of I cannot talk about it very strongly, but I feel there is both in the minds of people, public in general, and in the minds of healthcare professionals, that is doctors, there is more nutrition in their mind, whether it is leading to referrals or no, or whether people are actually walking into the clinics of dietitians. Because like Dr. Bijal said very rightly, preventive role of nutrition is very, very big. But the point is, I am yet not sure how many people have understood that. So,
Okay.
so more often than not, even now when people come to us with a high HbA1c or very badly controlled lipids, and when they become better, they say, "Arey madam, 4-5 साल पहले आना था नहीं." Now, there is no answer to this question, right? I mean, yeah, आना था, but नहीं आए. So I think what really needs is, like she said, like Dr. Bijal said, there is a lot that you can do, but the understanding, and one needs to be more proactive. The way people think is आज खा लेते हैं, 50
Yeah.
के बाद खाना नहीं है,
Yeah.
और एक दिन सभी को मरना है. So if you have those kind of blanket statements, yes, it's going to be difficult. But I am happy that now the students which are coming out now are coming out in a generation where at least nutrition, like Niti said, is considered as a science. So, it is way beyond that, there is a dietitian in the kitchen who's doling out recipes. It's a science. They run OPDs. There is much more awareness. And I think people are also aware that if they're taking newer kinds of drugs, at least the ones who are taking, they need to take nutrition more seriously, whether it is drugs or whether it is surgeries.
Yeah.
Both. If they are both of them, if they are doing it or they are availing benefits of them, then nutrition is like a thing that they need to do with it. Yeah.
So my loud and clear 2 cents to this is the loud and clear usage that I do is of nutraceuticals to answer this. When, like you said, how much people think nutrition is important from a preventive angle. If we show them results with nutraceuticals when they're actually not doing well and balanced, of course, with the nutrition plans, you get quicker results, and then the belief sort of is increasing in the whole therapy itself. So which is why I try to voice nutraceuticals along with nutrition very loudly, especially in people who are already suffering. So at least the change will be seen. My mom is suffering this, so I shouldn't suffer this. So the
True.
next generation is also looking at it and then starts learning to be more preventive. So that's my way of tackling things, of course. But having said that, now we have a lot of questions, 3-4 more questions which I want to take cross panel. And again, coming back to noise and misinformation again, I'm trying to address that a little bit more here today, because we see so many proteins, supplements, superfoods. All this is so noisy right now, and every second reel sometimes starts popping up around this, and people are trying to differentiate their products and differentiate so many things. And so is it too much of hype, or you think patients are still very undernourished, and where it truly matters? I think as practicing nutritionists, maybe Niti and Shilpa, you can answer this pretty well.
Is there too much hype? There is. Is there need? There is. And hype and need have to marry each other. So, people who need it, see, it's a weapon. Using protein supplement is a very powerful weapon, or using any kind of supplement, but it has to be used by right person at right doses at right time, and not driven by an Instagram reel, like Niti said. It has to be driven by a professional, understood, given a right kind of supplement for the right person at the right time. So everything has to marry each other. Just because somebody took some supplement, did something better happened of them, it is not a blanket statement for the whole world to take it. So, I think supplements are important. Supplements are here to stay. But who is taking those supplements at what point and how long? All these has to be decided by a professional. This is science. This is not, like Niti said, it's not as simple as giving. I mean, I'm not saying giving out recipes are simple or wearing a sari is simple, but this is even more complicated, is what I'm trying to say. And this can lot of times make or break your health. That's the problem. Because once you have done harm, it's very difficult to undo the harm. And hence, it has to be taken in more seriously.
Despite being a nutraceutical formulator and marketer, having founded this kind of a company, I'm asking you all these questions and asking you to address them, because your voices need to be heard, because it's not about marketing and selling these products. It is about making the difference at the end of the day. Otherwise, what's the real use in actually working in the nutrition segment? Then there are so many quick fixes and fast fixes that can be anyways learned from social media universities, or there are a lot of drugs which can be popped and you can still keep going. So if you have to make a deep core change, then the way even the nutraceutical and supplement manufacturers are working they really need to think about this. Did Niti, did you want to add anything?
Yes, I think when it comes to supplement, the market shelves are just burgeoning with these supplements. I think what one needs to look out as a consumer and as a professional also is the quality, which is extremely important. The efficacy, also in what concentration are these supplements in the bottle. Sometimes consumers see, oh, there are 20 ingredients, and they're very happy that they're getting their money's worth. But if those concentrations are in absolutely minuscule amounts, it has no meaning. Also, because supplement industry is not as well regulated anywhere in the world as the drugs, they do not have to go such stringent pass through stringent guidelines. Unfortunately, quality is always a question mark. So I think consumers need to be a lot more discerning when picking up the supplement. The brand, how good these do they have history, because this is very very important. You can be churning out supplements every week, coming out with a new product, but the efficacy, the formulation, the combination, and the concentration is, I think, extremely important.
I mean, all right pointers, less or more, the ingredients really have to be thought through. They have to be thought through for the side effects as well. All this really needs to be balanced out. Also, when you spoke about regulatory, yes, it is less regulated, but these days, it's also misregulated, is what I can say. That, places where we probably need to go a little easier so that more people can gain access to certain products and formulations. Sometimes it gets very difficult because it's not you're not allowed to make claims. You have to go through clinical trials, and doing clinical trials are not as easy as doing clinical trials otherwise with drugs, but also it's very expensive. So all these considerations really need to be thought through. And but our authorities are trying to do a lot of things these days. So which is actually, again, like you said, it's a sweet spot and it's encouraging, so to see that. But with that, another question, a little more about supplementation before we move forward with other things, is when it comes to inflammation, pain, recovery, these are the words which, earlier people didn't believe, but today, even healthcare professionals, post-COVID, of course, inflammation has gained a lot of attention, but also recovery, using nutrition in pre-surgical treatments, etc. So this wasn't something which was a easy scenario earlier. But what are your views on, having anti-inflammatory nutrition supplements, especially in these kind of situations? Can they really support the recovery when integrated with lifestyle and medical care and with our nutrition planning?
Uh, Yes, so absolutely, they can be extremely useful, and anti-inflammatory diet is the buzzword now, and it's basically a healthy diet that we are looking at. Now, if this is supplemented with nutrition supplements which have enough evidence of being antioxidants or anti-inflammatory, yes, they can be very useful for something as simple as turmeric. Having that little turmeric in your glass of milk, or having that little turmeric compared to having a turmeric supplement which is has much higher potency, there is a difference. So the supplements, and as the name suggests, supplements supplement the diet. So the
Yeah.
diet has to be an anti-inflammatory, healthy diet, and we can augment the effects of this diet by using the correct supplements. Absolutely, and they are actually very useful in many and inflammatory conditions, beginning from PCOS to endometriosis to autoimmune disorders. So yes, they have a role to play, but they supplement the therapy. So they are not in place of drugs. They are not in place of the diet. They are together with this.
So you'll find this interesting, but we had a session in the morning with doctors from different therapy areas, and one of them actually pointed out, one of the newer generation ones said that we should speak about dietary inflammation, which we've been speaking about for a long time. So I'm definitely going to be scheduling a session on dietary inflammation, and your insights and inputs definitely are, or each of you is going to be very nice to see. So this question was more towards driving towards it also. And I'll now go back to weight loss and aesthetics, and we spoke about quick fixes, but are people are really focusing still more on weight loss, aesthetics, and ignoring really the metabolic health? What do you see is the current scenario? Any of you can take it. Yeah. Yes, Shilpa, of course, your area.
No, no, it's all our area. Everybody has a. Um, I think there are two categories of people. So there are people who truly do it for aesthetic, and lot of time that is professionally driven. So if it's models or somebody in entertainment industry and so on and so forth. But most of the people who actually go that route is for metabolic reasons. And with increased awareness, there is definitely awareness that weight is something which is a driver for a lot of metabolic problems, and therefore watching your weight has been there for a long time. But now that there is I wouldn't say easier, but now that there is a solution which sort of guarantees you sometimes up to 20% weight loss, I think that is something that, and then that is something that attracts people more, where they're talking about preventing heart disease, preventing diabetes, even using it in, for example, kidney care or nephro segment. So I think that is there, and then aesthetics comes as a part of it. But aesthetics nowadays, we know, we are hearing so much about loss of facial muscle mass, and therefore having sunken faces and a very sarcopenic look. Even that has been spoken about, where these are not such good effects of weight loss. And I think that's where lifestyle comes into being, wherein yes, if you want it as a supportive treatment, if it is required, if for example, somebody has sleep apnea and needs to lose 20% of weight to sort of prevent other complications, yes, this is a faster method. Or a lot of times these drugs are given before a weight loss surgery, so that you have smaller liver size and other things. Yes, where it is required it is, but one cannot forget that it is supplementary to a good lifestyle. You cannot be not having a good lifestyle and just taking these drugs.
Totally. And with that, I am going to move to two very important questions, because all these discussions are indicators in driving towards these two important questions, which I would want all three of you to opine on. One, of course, is the first one, of course, is, do you believe that the time has come for nutritional experts to sort of get together to create unified protocols? I know it is already happening, but maybe more stronger clinical evidence that can be gathered, greater influence in taking healthcare decisions, how this whole market is regulated, also doing clinical trials for significantly good nutrition products, vis-a-vis, where we are seeing so many drugs that are getting invented, when there's so much more to nutrition science. How could we sort of come together? So do you all think, what are the areas you think we should really, first, should we come together, and which we already are to an extent? Do we strengthen it further? And then what are those aspects where you think we need to come together for? So any of you can start.
Right. So I think it's a very, very important point. One is that one big issue is that what we sorely lack is Indian data. So we, for every most of the stuff, we do follow the Western guidelines. Of course, now with diabetes, with a lot of other conditions, with hypertension, we have the Indian guidelines also. But and it's a very welcome change. But we do need a lot more Indian data. For example, these newer weight loss drugs, all the data is Western data, and when we are what we are seeing in his practice is not what is there in the literature. We are not getting those magic numbers, right? So the we as a race perhaps are responding differently. So we do need a lot of Indian data, and I think here we would also love Dr. Bijal to come in, because uh, the academicians have the research capabilities. They also have the students, while those in practice have a lot of data, but they don't know how to uh, turn them into papers. So if there is a collaboration between the academia and the practicing professionals, then it's again a win-win situation for us, and we do need a lot of Indian data.
Absolutely. I think institutionalization of things is extremely important. And Dr. Bijal, you can add your inputs to this, because
Ye-
significant actually.
uh, Very rightly said by Miss Neeti Desai, ma'am, that yes, we need vital evidences so that we can bang on that this is the pathway that is helping in managing this acute or chronic diseases. We are working as an institution towards it. You will surely see a lot more data coming with regards to diabetes, because in the last academic year, we did a lot of Indian foods where we looked at how glycemic index is helping in controlling the blood sugar levels with a comprehensive output. So we monitored their blood glucose level, we gave them various instructions with regards to other meal through the day, how they can consume. We ask them to relax and sleep for at least 8 hours. We also ask them to, get involved in moderate physical activity, and then we have data. So you will soon see papers coming out of all those results. And I think that will help you as a practitioner to gain more knowledge with what results are showing in Indian population, which are lacking because we have data coming from abroad, but lack of Indian data, as Neeti ma'am correctly said. So yes, we are in the process of publishing few more papers in the coming academic year. Yeah.
All good things to hear from the academic side. And on that, Shilpa has to opine on this, because Shilpa has been so much active on the idea, the Indian Dietetic Association front. Neeti has been equally active on that front. So, I think they've already been doing a lot of things. So, how do we escalate all this? How do we sort of integrate between Shilpa, you have been, and you're a diabetes educator as well. On the other hand, you've been part of a institution like IDA. You're practicing on your own. So, how do we sort of marry all these things? Academics, then IDA and the associations driving it, and at the same time, so many different nutritionists that are there who are practicing. So, how do we integrate all this? And on the other hand, we have products. So, how do you envision the marriage happening in the coming years?
So I think as an association, I mean, we have less of that in India, but we should have more of that. Is associations creating standard protocols, which can be probably used by dietitians working for an institute, a hospital, or on their own, who can conduct this research. But I think before that, it's very important that lot of us get good training. Lot of dietitians get good standardized training on how research needs to be conducted, because like you rightly said, the research is, I mean, it's expensive, it's also time consuming, and very important is it needs to be standardized. So I think this is something that is important. Other thing, well, like you rightly pointed out right in beginning, research of a drug versus research of a food is completely different. Yeah, so there the variables are different, and so same variables cannot be used. They are way more complicated when they come into a format or a food matrix. So even nutraceutical is easy because it's the nutrient alone, but when these come in form of food matrix, they become very very complicated, and therefore the standard training to be given is also very very important, because these things, there are a lot of variables involved. So I think we all need to come together, whether it's academic institute, whether it is hospital based dietitians, whether it is dietitians who practice on their own, or dietitians who practice with doctors. We all need to come together, and we need to formulate standard protocols which can be used across all the arenas.
Absolutely golden words. And I've been actively working towards it for a long time. And I think I'm going to energize those efforts much much more, because you all have energized me further. So, I think expect more sessions, audience also, and the nutritionists as well, who are watching this, that we are going to be coming up with a lot more that will go on this side. And any which ways, we are seeing a lot of noise happening in what do we call it, the market, and as well as the therapy segment itself. Niti, you wanted to add something to this? I'm sure you wanted to add something more.
No, absolutely. I think there needs to be a collaborative effort, and we as a fraternity, if we can, the practitioners, the academicians, all of us can get together, collate the data, and come out with standard guidelines, which is pertinent to the Indian population. Um, that would be great, because then we as a fraternity are speaking the same language, the same message is going to people across the country. Otherwise, very often the clients or patients are also confused. They come saying, "But she said that and he said that, but in hospital I was told this, but now you're telling me this." So,
Exactly.
we all need to speak the same language. Yeah.
So I think with that message, I'm going to go to a quick rapid fire before we close the session, and I would want you to stick to a word or a line long answers. But if you want to, of course, add something more insightful, feel free to do that. And I will start the rapid fire with Shilpa. Shilpa, diabetes, which we always keep coming to you for. Diabetes reversible or lifelong?
Remission possible, reversal difficult. Um, Remission till you keep the lifestyle on. Remission is difficult, but you can go towards different levels. You can improve your HbA1c, keep it low down, but reversal difficult. Remission, yes.
And when it comes to weight loss drugs, is it a solution or a support system?
It's a support system.
And
There is no solution. Solution is uh, being at it all your life.
like you said, lifestyle.
Yes.
And fasting, is it metabolic tool or overused trend?
Both, I think. It's a metabolic tool for a person who is sensitive to it. See, it's not meant for everybody. It's a tool, and a tool is very individualized, right? So, yeah, it is a good tool for a person who can do it, but it is overhyped, and people have come out with different strategies to carry it out. I think it's both, but it is definitely a tool in individuals who can do it.
Interestingly, a gastroenterologist, very senior gastroenterologist, Dr. Bhatkande ma'am, had very similar insights, and she gave such great insights in the morning. I had this question put to her also. So, when we are talking about marrying things together, also insights from the doctors and healthcare practitioners is something
Yes,
which
yes, of
is really
course.
useful, especially the senior ones. Neeti will, of course, agree on that point very evidently. But going to the next rapid fire for you, Shilpa, balanced fiber supplementation, is it helpful in metabolic diseases?
Fiber is probably the only nutrient which has consistent data in metabolic health. Even proteins and fats and carbohydrates, none of them have. Fiber is one nutrient that has, and if you can get it from diet, it's absolutely great. But
Yes.
if you cannot, then maybe supplementation. But try to get it from your diet. Eat whole foods, vegetables, fruits, whatever it takes. Try to get it from whole foods.
So, also when it comes to one food you wish every diabetic patient would stop immediately.
High fructose corn syrup.
Very much right. And it's hidden. So if you don't read the
Yeah, it's
label,
hidden, and hence reading labels and reading the ingredient list is very, very important.
yes. Next questions to Neeti. Neeti, your rapid fire starts now. In your clinic, what works better, strict diets or sustainable habits?
Absolutely sustainable habits.
Yes.
Anything you tell, ask. I mean, for us, it's practical. If it's not sustainable, it's not going to last.
Yes.
Like that will last for a week, 10 days, depending on the motivation of the person. But then they
Yeah.
fall off the wagon.
Like they're even trying to talk about, say about the latest, weight loss drugs. Even now, everyone's talking about eventuality. If you don't keep up, wants to stop them, or if you don't follow sustainable habits, that's going to fail too. So then the next question is related to digestive enzymes, something which is my favorite topic. Is it essential for modern gut health?
Uh, it's again, it's not one size fits all. They can be very useful in a lot of conditions, but it's not something that we would ask everyone to have. But yes, they can be very, very useful.
Anti-inflammatory supplements, we spoke a lot about it, but and we all agreed that they're effective in recovery. So I need not ask you that as a rapid fire. It's yes, I guess. And then again, of course, with caveats. But cheat meals, okay, or a slippery slope?
No, cheat meal is important. It's not meals, it's a meal in a week. But again, extremely important for long term compliance.
Okay.
It needs to be specified to the patient. What do you mean? So, the most common question when I say
Yeah.
one cheat meal a day, they say it's a cheat day, right? No.
Yeah.
It can be a slippery slope completely, but
Yeah.
it is essential. It is essential
Uh,
to have.
Yeah, I mean, a cheat meal can't be a jalebi, so or maybe it can, I don't know, but it depends on the patient. One habit most people fail to maintain despite knowing it's important.
I think in the modern day and age, it's the sleep routine, extremely important. And also, the other important thing is that we are all looking at what we are eating. But now it's even more important to know when we are eating. So the time, the chrononutrition, the timing of your eating also matters a lot.
Great. That ends your rapid fire, and now the rapid fire moves to Dr. Bijal. Dr. Bijal, packaged nutrition, science, or smart marketing?
Both. Both are
Right.
important for today's consumers.
Agree. It has to be science which is marketed well, isn't it?
Yes, yes.
Yeah, and food labels, are they read or are they ignored?
So they should be read and they should be understood.
Yeah, totally.
So that's important.
Absolutely. Read and understood.
And
Uh,
understood.
and future of food, lab driven or farm driven?
I would again say both. We have microgreens today.
Yes.
So something that is lab driven, but the lab driven food is helping to improve the nutrients, which is
True.
grown at your home gardens. So yeah, both.
Uh, Gen Z more aware or more confused about nutrition?
So I would say more aware, but again, it is conditional with Gen Zs.
Yeah,
So
that's the right
it's,
word. Conditional.
yes, conditional.
And are today's students better equipped for nutrition counseling than before?
I think yes, with curriculum advancement and with new education policy in play, yes, they are more efficient to counsel patients, to encourage them to follow the guidelines and to follow personalized nutrition than the generic guidelines. So yeah.
Um, with that, I think I hope you all enjoyed the program as much as the audience will. And it has truly been insightful hearing from you. It's always having Niti and Shilpa has always been a pleasure. Dr. Bijal, it's is really nice to have you on our platform for the first time. And hearing all this from you has been so much of learning for all of us. And I hope you all enjoyed the rapid fire segment as well. But with that, I would want to and request you to leave us with your takeaways, maybe one myth which we should forget, one powerful habit we should practice regularly, or anything else that you want the viewers to be left with. Go for it, Niti.
Right. So, everybody is looking out for that balanced diet, that elusive balanced diet. Its balanced diet is just having a variety of foods in moderation. It's no rocket science. It doesn't need a lot of planning. Have a variety of foods, include all food groups, and have them in moderation, and you got the balanced diet on your plate.
Awesome. Any one of you wants to go? Dr. Bijal, go
Oh,
ahead.
yeah. So I have one takeaway: reading and understanding label to make better food choices and avoid hidden gimmicks
Yes.
or marketing strategies by the companies. So very, very important.
Yes.
Yeah, thank you.
Pretty much agree with that completely, actually. And to end the session, Shilpa, your insights, of course.
Uh, I think, Niti has spoken about it extensively. Sustainability is important. And hence, eating should be an informed decision. Don't eat because there is nothing better to do. You are in a movie, there's nothing better to do, so you're eating popcorn. You are at work, and there's nothing, no, not much, too much work, you're eating. I think eating is a very
Cover
important.
birthday, you go for a buffet.
Yeah. So I don't know, but there is a saying in Ayurveda that anna hai yajna karma. That means it's like performing a havan. You are actually metabolizing and producing energy. So it's a very important activity. Don't take it lightly. Um, Eat when you are hungry. Like Niti said, eat balanced food. Like Dr. Bijal said, be informed about what you're eating. Just not read it, understand it, assimilate it, and then consume it. So I think it's a decision that you make. Nobody can force you, and do not get forced on. to eat by anybody.
So I think I will, while we are closing the program, I would request you panelists to be there after we go offline for 2 minutes before we stop the program. Uh, Okay, and so I'll close this by just putting a few thoughts together. Is that what we've heard today clearly shows that nutrition is not optional. It is central to healthcare outcomes, and the future of healthcare lies in its integration and personalization. At Truwellth, our mission is to reverse control and prevent diseases by integrating science, evidence based nutrition, and lifestyle management with medical practice. But beyond this, there is a larger responsibility to bring experts like you together to create a strong, unified nutrition ecosystem that can develop protocols, drive clinical evidence, influence healthcare decisions, and truly elevate the role of nutrition in medicine. Because the future of healthcare will not be driven by isolated treatments, but by integrated, evidence based, and collaborative care. Thank you basically to each of you esteemed panelists, for sharing your valuable insights, and to our audience for being a part of this journey towards better health. Viewers, I would also like to reiterate the goal is not just to live longer, but to live healthier, stronger, and better for longer. So, here's wishing our esteemed panel speakers and our viewers true wealth of holistic health and happiness on the eve of World Health Day. This is Rajashree Gadgil signing off for today, and will be coming up with more soon.
Thank you.
Thank you.
Thank you, everyone. Rajashree, you want us to be there, or we can sign off?
I think it's still streaming.
Oh.